Smoking cessation, health inequalities. In the UK, smoking rates have declined year on year.
Two groups of stick figures are shown. One group has a higher number of smokers than the other. Some figures disappear and others become ill from both groups, but more from the group with the higher number of smokers.
They remain high in some communities, and because smoking is so harmful, differences in smoking prevalence translate into major differences in death rates and illness.
An NHS infographic titled Reducing Health Inequalities is shown. The infographic lists the 5 key clinical areas as maternity, severe mental illness, chronic respiratory disease, early cancer diagnosis, and hypertension case finding.
The NHSE Core 20+5 highlights the positive impact stopping smoking can have on all the 5 key clinical areas. Health inequalities are preventable differences in health outcomes between different population groups.
Two stick figures are shown on either end of a scale. The figure on the left is a smoker holding a small amount of money. The figure on the right is a non-smoker holding a larger amount of money. A cigarette is shown in the gap between the figures.
Smoking is the leading cause for the gap in life expectancy between the least deprived and most deprived. In 2020, there was 80,000 deaths due to COVID-19 and 94,000 due to tobacco. There's around 7 million people currently smoke in the UK. Most people in Leeds do not smoke. However, smoking remains the single biggest preventable cause of ill health and mortality.
A cartoon figure of a white middle-aged male is shown. The figure waves, then smokes a cigarette.
This is Gary. Gary is one of the 120,000 people in Leeds who smoke. Gary lives in Middleton in Leeds. Because Gary lives in an area of deprivation, he is 4 times as likely to be a smoker. Gary is likely to die prematurely from a smoking-related disease.
A group of 10 stick figures representing smokers is shown. All but 3 of the figures fade away.
More than 50% of smokers will die from smoking-related diseases on an average 10 years earlier. Every year, nearly 1,000 people die and around 5,500 are admitted into hospital in Leeds for a condition relating to smoking.
The cartoon man reappears and shows his empty pockets while looking downward.
Smoking is expensive. Gary, like most smokers in Leeds, spends £44 every week on cigarettes. That is around £2,300 per year.
3 columns are shown. The first is titled Amount Spent on Smoking and shows a cigarette. The second is titled Low Income Weekly Budget and shows a stack of money a little taller than the cigarette. The third column is titled Higher Income Weekly Budget, showing a stack of money much larger than the cigarette.
The cost of smoking is disproportionately felt in low-income smokers who tend to smoke at higher rates, spending 5 times as much of their weekly budget than wealthier smokers. Because Gary smokes, he is less likely to be employed. Gary and his family are living below the poverty line. It is estimated that 32% of households with a smoker are living in poverty. If these smokers were to quit, around 7,000 households in Leeds could be lifted out of poverty. Because Gary smokes, his children are 4 times more likely to take up smoking later in life.
A graph indicating that the rich live longer than the poor is shown.
Smoking is the lifestyle factor that impacts the most, accounting for up to 9 years of the gap in life expectancy between the most deprived and the least deprived. By working with smokers like Gary to boost quit attempts, we can reduce smoking rates and therefore work towards reducing health inequalities in Leeds.